Hello, my name is Anand Bhopal. I'm a postdoctoral research fellow at BCEPS. Today we're going to talk about sustainable healthcare and priority setting. I'll run through a bit of background for this field, I'll discuss some of the key concepts and challenges, and then develop a few worked examples, and we'll finish by discussing some of the considerations for ethics and for taking action in this area. So let me begin. Global health is a story of progress. Now what this graph shows is the risk of death in different age groups, that's the different colours, over the period 1970 to 2010. And we see that in every age group there's been progress across the world, and we see that by every income group, from low income, lower middle income, upper middle and high income, the same. So we've had huge progress over this period. However, there are huge challenges ahead. This is where priority setting comes in. We're constantly seeking to balance competing priorities. Now, priority setting could be thought of as aiming to improve health in a fair and efficient way. It aims to seek for decision-making under resource scarcity. And this inevitably involves trade-offs between competing goals, which include, typically, cost effectiveness, inequality, financial risk protection, and some others. Now, critically for this talk, this is a constantly evolving and it's shaped by societal values. Now, one of these changes is sustainability. Now, what the artist here has done is, after having a breast surgery, she asked the team, the surgical team, to hold on to every item that was used during that surgery. Every item was kept, cleaned, and is now displayed around her. You may recognize this image. She's evoking Da Vinci's Renaissance man. Now, Da Vinci is drawing a man in perfect proportion, and the artist here is challenging us to think whether we are living in proportion to the planet we call home. Because the challenge that we have is we have a world of rising temperatures, which this globe illustrates, and the world is warming fastest around the poles, the North and South Pole, and around the equator. This is leading to a range of health problems, including malnutrition, heat, and changing epidemiology of infectious disease. Now, this is caused by greenhouse gas emissions. And what we need to do is to get these emissions to fall and then disappear altogether if we're to hold temperature rise in check. Now, one way of thinking about this is that we have planetary boundaries, or an ecological ceiling, while trying to meet a social foundation, which is trying to provide health and well-being for all. And there's a sweet spot in the middle. This is represented by the donut model, which is about an ecologically safe and socially just space for all. So let's focus now on sustainable healthcare. Well, what we know about healthcare, shown in this graph, is this is healthcare carbon emissions from the health sector along the y-axis, and separated into income country groups. And what you can see that is in high income countries, they have the highest healthcare carbon emissions, and much, much lower in low income countries. Now on the z-axis here, we have unmet healthcare needs. And you can see the inverse is true. These are highest in low income countries and lowest in high income countries. So this is a question of equity, which is a huge concern to priority setting. Now, what we know is that healthcare is responsible for around 5% of global greenhouse gas emissions. Now, this is substantial. This is on par with some major polluting industries like shipping, flying, and by some accounts, both of those put together. So if we look at more detail then, this is a breakdown of carbon emissions from the health sector taken from the NHS, National Health Service in England. Now the emissions broken down by source, we can see anaesthetics and inhalers represent about 5%, medicines and medical equipment, around 20%. Transport cumulatively represents about 15%, that's ambulance and patient and staff travel. Then we have buildings and water and waste, so the production and disposal of waste. And finally, we have lots more in the supply chain itself. Now, the policy framework globally is led by the World Health Organization. And at the COP26 Health Programme in Glasgow, there was a launch of something called the COP26 Health Programme. This had two commitment areas, one to develop climate resilient health systems, and the other, the focus of this talk, is to develop sustainable, low carbon health systems. And the aim was to achieve net zero emission health systems by 2050. Now, what this map shows is all the countries that have to date signed up. And you can see there's broad representation across the world. The challenge, of course, is getting there by 2050. Now, the aim is to get all countries into this area of high health system performance and low greenhouse gas emissions, bearing in mind different countries have different starting points. So there's clearly some issues that are relevant to equity and that are relevant for priority setting in health. So let's look into more detail. I said at the beginning that priority setting is about resource constraints. It's about, and this is often conceptualized through the UHC cube, the Universal Health Coverage Cube, which is generally about balancing which population is covered, how many services are included, and the direct costs to patients, recognizing that it's difficult to do everything at once. Now, of course, a key constraint is financing, health spending. This graph shows health spending, again, separated by income groups, and we see huge differences across the world. All face challenges of resource constraints. There is more that could possibly be delivered than the resources that are available. And this problem isn't going away. By 2050, we'll have more financing available, but that challenge of needing to make tough choices and trade-offs, that's not going anywhere. Added to this, which is the focus here, is well, we also need to be thinking not just about that traditional cube, but also about thinking about sustainability and these climate change implications. So let me run through a couple of examples. Firstly, let's think about health technology assessment. Now, health technology assessment is often used to evaluate different medicines, vaccines, and other devices of sorts. And what we try and do is think about different elements: safety, clinical effectiveness, economic considerations, and so on, including ethical issues. And the question is, how do we integrate environmental sustainability here? We can do that conceptually, but there's a further challenge when we look at the detail. So let me give you a couple of examples. Anesthetic gases, I mentioned, were responsible for around 5% of healthcare's greenhouse gas footprint. And we have two alternatives here. Well, these are two anesthetic gases, one desflurane and another sevflurane. Now, desflurane is about 20 times higher polluting than sevflurane. A similar story plays out with inhalers. Metered dose inhalers have a greenhouse gas propellant, and dry powder inhalers involve suction drawn from the patient themselves. So there's often these differences. But it's often also not so simple, a simple switch between two alternatives. It's also about values, and that question again of, are we developing a health system in proportion to the planet? So let's think then about that worst climate impact. I mentioned here about inhalers. Well, the same goes for healthcare facility levels. Broadly speaking, healthcare delivered in the hospital setting is much more resource intensive, uses more energy, more greenhouse gases are associated with that, compared to, say, primary care or community-based care. Similarly, about high-tech care. So, for example, robotic surgery uses a lot of energy, a lot of resources, in comparison to, say, somewhat more traditional keyhole surgery. Now, the challenge here is that we've traditionally been thinking about balancing money and finances, cost effectiveness, With workforce, that's also a resource constraint. But here I'm introducing the idea of pollution being a resource constraint as well. So if we just look at the essence then, we're thinking about environmental impact and think about two alternatives. Those could be anesthetic gases, that could be hospitals versus primary care. The question is, how do you evaluate the difference between these two alternatives? That's the challenge here for priority setting. So let me finish with a few complexities, and in the description below you will find some relevant papers that you can look into these issues in more detail. So complexities for ethics. Firstly, climate change and sustainability has a global dimension. Priority setting traditionally has been focused on the national level, so there's a need to balance national and international priorities. Time. We need to balance short and long term. Climate change is a very long-term problem, but it also has short-term implications. How do we get the right balance? Risk. We need to balance between things that we know will happen and things that may happen. So that relates to our trade-offs between environmental considerations and other things that we also think are important. And finally, inequality, which I've discussed a couple of times throughout this talk. We have inequalities both within countries and between countries, which we need to take account of. Now, if we want to do something about it, there are complexities for action. Firstly, we've got to reimagine high-quality healthcare. This has not traditionally taken sustainability into account. Culture. We need to be thinking about how do you actually engage people, clinicians, patients, health system providers. This is about changing hearts and minds. And related to that, you have leadership challenges. Who's actually responsible for developing plans? Who's responsible for delivering them? How do you develop accountability mechanisms that actually ensure something is done? There's a challenge of agenda setting, and that's broadly thinking about how do you build inclusive, democratic processes. That is something that priority setting has good experience with and would benefit from their expertise. And finally, research. How do you ensure that evidence informs action? We need the right research that meets the needs of policymakers. Thank you very much for listening.